Anti-psychiatry. In recent decades, psychology in general and psychiatry in particular have come under attack for inventing illnesses. One of the main reasons is how many new diseases have been added to the list over the past few years and decades. Psychiatry critics point that the difference between developing and developed world and how many different disorders are officially accepted in the developed world compared to the developing world. Another criticism has been the prescription of medicine. Nowadays, millions of people are on medication from which they find it difficult to come off. This anti-psychiatry sentiment is not new. Some of the criticism have come from other psychologists. David Rosenbaum, born in 1929, died in 2012, an American psychologist, wanted to find out if psychiatrists were good at judging sane people from insane. In 1973, he did a study in which he sent healthy men and women of various ages and jobs to various mental hospitals. They all pretended to be mentally ill, so they were admitted to hospitals. When describing their illness, they would use vague terms like hearing noises. After they were admitted to the hospital, they acted and behaved normally without showing any signs or symptoms of any mental illness. On average, they all stayed in a mental hospital for nearly 20 days, where they felt they were losing their sense of autonomy and power to be themselves. They kept a journal of their experience. At first, they did it secretly, but later openly, which was seen by the hospital staff as somewhat odd behavior. The staff didn't detect that they were fake. However, some of the other patients noticed that they might be fake. Rosenbaum repeated the experiment later, but this time he told the staff that among the new patients, there might be one imposter, someone who pretends to be mentally ill. The staff were asked to rate the new patients to find the fake one. Out of 193 real patients, 41 genuine patients were suspected as fake, and 23 patients with real mental illnesses were flagged as fake by at least one psychiatrist. So Rosenbaum showed that psychiatrists are just people who suffer from the same flaws their patients suffer, the inability to be the best judge of other people. As a result, psychology and psychiatry in particular has come under attack. In 1961, the Hungarian-American psychiatrist Thomas Szasz published a book titled The Myth of Mental Illness, in which he argued that mental illness is a way of labeling someone. He argued that a lot of what is termed as mental illnesses is simply life being too tough at times. So both Rosenbaum's study and Thomas Szasz showed that mental illness is not as clear-cut abnormality as psychiatry makes them. So to sum up, psychology has a very tricky job of diagnosing the human mind while using the human mind. This creates a paradox in which the observer is also the observed. Since we can neither fully disconnect consciousness from the subject nor from the observer, it's always an approximate science. The other paradox is, of course, the paradox of change. Zeno's paradox deals with measuring space and time. Psychological paradox is similar in that as soon as you understand the human personality, it has changed or moved on. Therefore, psychology is a catch-up endeavor without the ability to fully catch up. Another biggest paradox of psychiatry is the more we know, the more disorders are diagnosed. In other words, the more psychological parameters shift, the more illnesses it finds.